Have you ever wondered how something invisible could quietly reshape your entire future without making a sound? In the journey of chronic kidney disease, many people fear what they can feel: fatigue, swelling, weakness. But few recognize the silent force working beneath the surface, steadily accelerating damage in ways that seem almost unfair. Metabolic acidosis is not loud. It does not announce its arrival with dramatic pain or sudden crisis. Instead, it moves patiently, subtly shifting the chemistry of the body, altering balance, and quietly challenging the strength of muscles and bones. When the kidneys begin to lose their remarkable ability to filter waste and regulate the body's delicate acid-base equilibrium, acid starts to accumulate in the bloodstream. This shift may appear small on a laboratory report, just a number slightly outside the normal range. Yet within that number lies a powerful story about resilience, vulnerability, and the urgent need for awareness. Dr. Mathew R. Weir has often emphasized, through his educational philosophy, that numbers in medicine are never just numbers. They reflect processes unfolding within the human body, processes that can either be slowed with knowledge or accelerated by neglect. In chronic kidney disease, metabolic acidosis becomes a hidden force that speeds up muscle breakdown, weakens structural integrity, and places additional strain on organs already working beyond their limits. Muscles, which symbolize strength and independence, begin to lose protein as the body attempts to buffer excess acid. Bones, which represent support and endurance, gradually release minerals in an effort to neutralize the imbalance. What appears invisible becomes deeply physical over time. Yet within this reality lies a powerful truth. Awareness changes outcomes. Understanding metabolic acidosis transforms it from an invisible enemy into a manageable challenge. When patients and caregivers learn how healthy kidneys maintain acid balance, they begin to see how extraordinary the human body truly is. Healthy kidneys constantly filter waste, reabsorb vital substances, and excrete acids generated from daily metabolism. They maintain harmony in a system that never rests. When chronic kidney disease disrupts this harmony, the imbalance does not mean defeat. It signals the need for intentional action. Correcting metabolic acidosis through proper medical guidance, nutritional adjustments, and early intervention can slow the progression of kidney disease. This is not merely a clinical statement, it is a message of hope. It reminds us that even when the body struggles, informed decisions can restore stability. The philosophical lesson within this condition extends beyond medicine. Just as excess acid silently weakens the body, unaddressed problems in life quietly erode our foundations. Ignored stress accumulates. Unmanaged habits compound. Small imbalances grow into larger challenges, but recognition is the turning point. The moment we understand what is happening beneath the surface, we regain influence over our direction. Chronic kidney disease demands courage, but metabolic acidosis demands awareness. When patients choose to learn about their condition, monitor their lab values, and follow medical advice consistently, they participate actively in their own healing journey. Strength is not only measured by physical endurance, it is measured by the willingness to confront what is hidden. Metabolic acidosis may be silent, but it is not unstoppable. It accelerates damage only when it goes unrecognized. Once understood, it becomes another factor that can be managed with discipline, partnership with healthcare providers, and a commitment to long-term health. The silent force loses its power the moment knowledge enters the room, and that knowledge becomes the first step towards slowing the damage and reclaiming control over the future. There is a moment in every health journey when the surface story is no longer enough, when what seemed manageable begins to reveal a deeper layer of consequence, and this is where the true test begins. Chronic kidney disease does not advance in a straight line. It progresses quietly, influenced by factors that many people never see coming. Metabolic acidosis is one of those factors, operating beneath awareness, shaping outcomes while attention is focused elsewhere. At first, the changes are subtle. A little more fatigue, a little less strength. Recovery after simple activities takes longer than it used to. It is easy to attribute these signs to aging, stress, or temporary weakness. But inside the body, a different narrative is unfolding. The accumulation of acid is signaling muscles to break down protein in an effort to restore balance. It is prompting bones to release buffering minerals, slowly reducing density. It is altering hormonal pathways and increasing inflammation, quietly accelerating the very disease patients are trying to slow. This is where suspense lives, not in sudden crisis, but in the realization that what goes unnoticed can become powerful. The question then becomes, what happens if this imbalance continues unchecked? The answer is not meant to create fear, but clarity. Over time, uncorrected metabolic acidosis can contribute to worsening kidney function, increased frailty, and reduced quality of life. The silent force becomes a multiplier, intensifying other complications. And yet, within this tension lies extraordinary hope. Because unlike many uncontrollable forces, metabolic acidosis can be measured, monitored, and addressed. Blood bicarbonate levels provide insight. Nutritional adjustments can reduce dietary acid load. Prescribed alkali therapy, when appropriate, can help restore chemical balance. These are not abstract concepts, they are practical tools. Dr. Mathew R. Weir has consistently conveyed through his educational influence that patient empowerment begins with understanding mechanisms, not just memorizing recommendations. When individuals comprehend why acid builds up and how it impacts tissues, compliance transforms into commitment. Medical advice is no longer a rule imposed from outside. It becomes a strategy chosen from within. Suspense gives way to strategy. Fear gives way to focus. Imagine the difference between walking in darkness and walking with a map. The terrain may be the same, but confidence changes everything. In chronic kidney disease, knowledge of metabolic acidosis becomes that map. It reveals that fatigue may not simply be weakness, but a signal. It shows that protecting muscle mass requires more than exercise. It requires correcting internal chemistry. It highlights that bone strength depends not only on calcium intake, but on maintaining proper acid-base balance. The deeper lesson extends beyond physiology. Life often mirrors this condition. Hidden imbalances, when ignored, compound. Small neglect becomes large consequence. But intervention, even if gradual, redirects the trajectory. Correcting metabolic acidosis does not promise instant reversal of disease, yet research and clinical experience demonstrate that it can slow progression and preserve strength. Slowing progression means preserving time. Preserving time means preserving opportunity. Opportunity to remain active. Opportunity to maintain independence. Opportunity to continue meaningful relationships and purposeful living. The suspense in this journey is resolved not by dramatic rescue, but by disciplined consistency. Monitoring lab values regularly, adhering to prescribed treatments, adjusting diet thoughtfully, communicating openly with healthcare providers. Each action may feel small, but together they create momentum in the opposite direction of decline. This is the quiet power of proactive care. Metabolic acidosis may attempt to accelerate damage, but informed action can apply the brakes. The turning point is not found in panic. It is found in awareness, followed by steady commitment. And when that commitment takes root, the silent force that once seemed threatening becomes a manageable variable in a much larger story of resilience, responsibility, and renewed control. The final and most powerful realization in this journey is that the body is not merely a collection of organs struggling against disease, but a dynamic system constantly responding to the choices made each day. Chronic kidney disease may introduce limitations, yet within those limitations exists profound opportunity. Metabolic acidosis, once understood, becomes more than a biochemical disturbance. It becomes a reminder that balance is central to survival. When acid accumulates in the bloodstream, because weakened kidneys can no longer maintain equilibrium, the body begins compensating in ways that sacrifice long-term strength for short-term stability. Muscles surrender protein, bones release minerals, energy levels decline. But here is the deeper truth. Compensation is not the same as healing. The body adapts to survive, yet it depends on informed intervention to truly stabilize. This is where personal responsibility intersects with medical guidance. It is where awareness transforms into disciplined action. Dr. Mathew R. Weir has long emphasized through educational influence that slowing kidney disease requires attention to the factors that quietly accelerate it, and metabolic acidosis stands among the most significant of those factors. Recognizing its role is an act of empowerment. Correcting it is an act of preservation. Every balanced meal chosen with intention, every prescribed therapy taken consistently, every laboratory value monitored carefully becomes a declaration that progression will not go unchallenged. Motivation in this context is not loud or dramatic. It is steady and deliberate. It is the decision to care about numbers because those numbers reflect muscle integrity, bone resilience, and overall vitality. It is understanding that bicarbonate levels are not abstract statistics, but indicators of whether the internal environment supports strength or decline. When patients grasp this, their mindset shifts. They no longer view treatment as a burden, but as a protective strategy. They recognize that slowing progression means extending independence. It means maintaining the ability to move freely, think clearly, and live meaningfully. The suspense that once surrounded hidden damage is replaced by clarity about controllable variables. Even though chronic kidney disease cannot always be reversed, its pace can often be influenced. That influence matters. Time gained through careful management is time available for family, purpose, growth, and contribution. The philosophical lesson extends even further. In life, balance determines sustainability. Excess, whether chemical or emotional, eventually extracts a cost. Correction requires humility, awareness, and action. Metabolic acidosis teaches that what is unseen can still shape destiny, and that vigilance is a form of strength. By addressing acid imbalance early and consistently, patients send a powerful message to their own bodies. Decline will not proceed without resistance. Hope in this journey is not wishful thinking. It is structured effort guided by knowledge. It is partnership with healthcare professionals. It is the courage to face laboratory results honestly and respond proactively. It is the refusal to allow a silent accelerator to dictate the speed of life. The hidden force loses authority when confronted with informed persistence. Strength returns gradually. Stability improves steadily. Confidence grows quietly. And through that growth, individuals living with chronic kidney disease discover that while they may not control every outcome, they can influence the direction. They can slow the pace. They can protect what remains strong. They can transform awareness into endurance. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.